Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Let's get to today's top news. Assam government imposes restriction on private practice by government doctors during duty hours. In an effort to stop private practice among government doctors during official duty hours, the Medical Education and Research Department of the Assam government has issued a strict directive. This new regulation prohibits government doctors from practicing in private hospitals and nursing homes during their designated working hours. Dr. Siddhar Singh, IAS Commissioner and Secretary of the Medical Education and Research Department, addressed the Health and Family Welfare Department with a new order. He instructed the Director of Health Services Assam to ensure that all private health institutions registered under the Clinical Establishment Act comply with this directive, preventing government doctors from practicing in their establishment during duty hours. This measure follows a review meeting held by Assam Chief Minister Dr. Himanta Biswa. Additionally, the order mandates the Joint Director of Health Services Assam to conduct periodic inspection of private clinical establishments to ensure adherence to the new provision. The responsibility for compliance lies with the private hospital and nursing home. In case of any violation, appropriate legal action will be taken against the non-complaint establishment. The order also requires monthly report of these inspections, including recommendations for any necessary action to be submitted to the government. Kerala government to implement special guidelines for Amoebic Meninoencephalitis. In response to the recent death and hospitalization due to Amoebic Meninoencephalitis in Kerala, Health Minister Veena George held a crucial meeting with the Health Department. The state plans to release special guidelines to address this rare but serious brain infection caused by a free-living amoeba found in contaminated water. The amoeba enters the brain through the nose or a perforated eardrum, leading to severe health issues. Medical Dialogues recently reported that shortly after a 13-year-old girl from Kannur succumbed to Amoebic Meninoencephalitis, a new case of this rare brain infection emerged in Kerala's Kozhikode district. The guidelines will emphasize avoiding bathing in stagnant water and ensuring proper chlorination in swimming pool and water parks. Children with ear infections should particularly avoid such water sources. Symptoms of the infection, which appear within 1 to 9 days, include severe headache, fever, nausea, vomiting, neck stiffness, epilepsy, loss of consciousness, and memory loss. Diagnosis is confirmed by testing spinal fluid. The health minister urged immediate medical attention if these symptoms are observed. The disease is not contagious from person to person but poses significant risk when contracted from contaminated water. Proper hygiene and caution are essential to prevent the infection. The government aims to raise awareness and strengthen preventative measures to control the spread of Amoebic Meninoencephalitis in the state. NEET PG 2024, NBA to announce new exam date by this week. Despite previous assurances that the new date for NEET PG 2024 would be announced by Tuesday or Wednesday, there has been no official announcement from the Union Health Ministry, National Board of Examination or National Medical Commission. This delay has caused significant confusion among postgraduate medical aspirants. A senior NBE official informed on July 2 that a new exam date would be released this week. The NBE has shared a plan with the centre and is awaiting approval. NBE President Dr. Abhijit Sheth mentioned that the new date will be announced before the weekend, pending approval from the Union Ministry of Education. Union Education Minister Dharmendra Pradhan also indicated that a date would be announced by Monday or Tuesday. However, the delay has heightened anxiety among students. Dr. Aviral Mathur, President of the Federation of Resident Doctor Association, expressed concern over the uncertainty affecting students and their families, emphasizing the need for timely information from their academic futures. Research links Mediterranean diet to improved survival and reduced heart disease in cancer survivors. The Mediterranean diet proves to be a powerful ally for health even after cancer diagnosis. According to a research published in the JACC Cardio-Oncology, individuals diagnosed with any type of tumor who adhered closely to the Mediterranean diet lived longer and had a reduced risk of cardiovascular mortality compared to those with lower adherence. The study examined 800 adults, both men and women, already diagnosed with cancer between 2005 and 2010. Participants were followed for over 13 years and detailed information on their food consumption during the year before enrollment was collected. The findings revealed that those who adhered closely to the Mediterranean diet had a 32% low risk of mortality compared to those who did not follow the diet. The reduction in cardiovascular mortality was particularly significant at 60%. The Mediterranean diet primarily includes foods such as fruits, vegetables, and olive oil, which are rich in antioxidants. These bioactive compounds are believed to contribute to the observed reduction in mortality from both cancer and cardiovascular disease. The study highlights the potential of Mediterranean diet to improve survival and reduce heart disease risk in cancer survivors, emphasizing the importance of dietary choices in managing long-term health. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.